Hello everyone, I'm Youssef and I'm going to discuss a very new and interesting topic that can change the way Parkinson's disease is managed. Our paper investigates the potential of using anti-inflammatory and immunosuppressive drugs as targeted therapies for Parkinson. It is commonly believed that Parkinson is a rare disease, but statistics show otherwise. In fact, neurological disorders as a whole are the leading source of disability, and Parkinson's is the second most common neurodegenerative disease. Parkinson is characterized by the progressive loss of dopaminergic neurons, with age usually considered as the single most important risk factor of this process, with 1% of the population above 60 affected with the disease. The major problem with Parkinson, however, is the lack of disease-modifying therapies, as all available therapies are symptomatic, an issue caused by the lack of sufficient understanding of the etiology of the disease. The trigger of this dopaminergic degeneration seems to be multifactorial, with inflammation and immune response increasingly being considered very important mediators of this degeneration. Microglial activation, pro-inflammatory cytokines, and increased reactive oxygen species, along with autoimmune antibodies, are all indicators of the involvement of inflammation and the immunity in the pathophysiology of the disease. So here a question is raised: what if this immune activation is a cause rather than a response to the observed neuronal loss? In an attempt to answer this question, we aim to examine the effects of anti-inflammatory and immunosuppressive drugs on Parkinson patients by conducting a computerized systematic review of studies related to the usage of these drugs. We use electronic databases like PubMed, Web of Knowledge, and Google Scholar. And from the studies we have reviewed, we found out some interesting results. First, regarding the anti-inflammatory drugs, large population studies confirm that people receiving NSAIDs have a decreased risk of developing the disease. And one of the first anti-inflammatory treatments to be investigated was minocycline, which has shown neuroprotective and anti-inflammatory activity in rodent models. However, in the clinical setting, it failed to show any clinical benefit regarding motor assessments. On the other hand, immunosuppressive therapies have proven to be much more promising, and in here two therapeutic avenues are being explored. The first avenue is Treg-mediated immune suppression, which works through the downregulation of both pre-inflammatory mediators and ROS production. They also have the ability to switch microglial responses from the neurotoxic M1 response to the neurotrophic M2 response. This therapy was tested in a phase 1 clinical trial using salem, which functions by inducing Treg responses. In this trial, patients receiving salem showed modest improvements compared to patients receiving placebo. In the second avenue, which is targeting alpha-synuclein, it hasn't proven to be any less promising, as toxic versions of alpha-synuclein can accumulate within neurons and cause a neurotoxic inflammatory immune response. Therefore, monoclonal antibodies against alpha-synuclein are being developed, and they have shown to attenuate motor deficits in mouse models of the disease. And from these results, we have concluded a few important points. First of all is that inflammation and immune response are closely related to the pathophysiology of the disease. And regarding anti-inflammatory therapy, we have used that they are better used for the prevention rather than the treatment of the disease, as these drugs have proven to be of no clinical benefit when the degeneration is already in an advanced stage. So we recommend the development of better diagnostic tools for the disease in order to start anti-inflammatory pharmacological intervention in the pre-symptomatic period. As for immunosuppressive therapies, they have proven to be promising in improving disease outcomes. Lastly, the mechanism by which immune system can use to control neuroinflammation is now being realized. The therapeutic potential of immunomodulatory therapies is an exciting advance and raises a real possibility for successfully changing the course of Parkinson's neurodegeneration. Thank you for your time.